Hey, today I want to talk to you about endometriosis. Endometriosis is a relatively common gynecological condition. It's estimated to affect about 1 in 10 women. And March this month happens to be Endometriosis Awareness Month. So I wanted to help do my part, shed a little bit of light on what endometriosis is and some of the symptoms of endometriosis. And then in a subsequent video, I'm going to talk about how endometriosis can be diagnosed. My name is Dr. Shannon. I'm a naturopathic doctor. I have a fully virtual naturopathic practice where I focus in hormonal health, fertility, pregnancy, and postpartum care. And I see a lot of patients with endometriosis. And it is something that's I'm going to say it's a bit of a tricky diagnosis or a bit of a tricky condition. What we tend to see is that people who have really severe endometriosis, and I'll describe kind of what I mean by that in a second, might not have very severe symptoms, and vice versa. That people have really mild endometriosis might not have very mild symptoms. So it's a bit of a tricky condition and a bit of a tricky diagnosis. Essentially, what endometriosis is a condition where normally we have our uterus. So our uterus is I kind of describe it like a thick muscular balloon. And every month with our menstrual cycle, we grow a uterine lining. It's sometimes called our endometrial lining. And that lining, grows thick. If we're not pregnant, we shed that lining, and then it grows again, and we shed it, and it grows, and we shed it. In endometriosis, what we tend to see is that this lining, or our cells that look the same as this lining in the uterus, can actually be found in areas outside of the uterus. So we tend to see it on our fallopian tubes, on our ovaries, in other parts of our pelvic cavity. So sometimes it can be like behind the uterus or in front of the uterus or attached to the bladder or attached to the rectum. Rarely, you can also get endometrial tissue growing in other parts of the body. So it has been found in people's lungs, and it's also been found in people's brains. And so that would obviously be a very severe manifestation of this disease. We don't know exactly what causes endometriosis. And again, that leads into it being tricky to diagnose and tricky to manage. It's thought of there's one of the theories of how it's developed is something called retrograde menstruation. So basically, instead of that, uterus and the lining shedding out through the vagina, we see that sometimes the lining can go into the fallopian tubes, and the fallopian tubes actually like empty out into the pelvic cavity. There's some other theories about how it may have developed. It tends to be genetic, meaning that if you have a close relative, a parent or a sibling who's had endometriosis, that you might be at higher risk of developing it as well, or more likely to have it if you have symptoms. But yeah, it's a tricky condition. And I want to just shed light today on some of the symptoms of endometriosis, because you might have been told, much like I was, that maybe you have endometriosis, but there hasn't really been any further investigation or look at kind of into your symptoms. And also, if you watch my last video talking about painful periods, you'll know there's a couple different causes of painful periods, endometriosis being one of them. And so to kind of understand if you're someone who struggles with painful periods, how might we know if your painful periods might be more likely to be endometriosis? So certainly some of the symptoms of endometriosis, or I would say the most prominent one, is pain. And we tend to see most obviously pain with our periods, so really painful menstrual cramps. But outside of this, people with endometriosis tend to also have additional kind of types of pain. So they might have, lingering pelvic pain after their period ends or throughout the rest of their menstrual cycle. They may also have pain with urination or with bowel movements. And I would say that's particularly worse around the time of that person's period. And these people might also have pain with sexual intercourse or sexual activity. So again, if that endometrial tissue is attached to different parts of the body, it can cause pain and inflammation, but it can also cause scar tissue and adhesions. So that can certainly cause some pain with intercourse for sure. Another symptom of endometriosis is infertility. So a lot of people who do have endometriosis don't actually get diagnosed with endometriosis until they have been trying to get pregnant for a number of months or up to a year or longer. And then they finally go to a fertility clinic. And in those fertility clinic investigations, they're diagnosed with endometriosis. So it is a potential symptom, or I guess byproduct of having endometriosis. A lot of people with endometriosis also have gastrointestinal issues. So they tend to deal with a lot of like IBS, food sensitivities, struggles with diarrhea, constipation, abdominal pain from eating. And for many years, a lot of people might be going to the doctor with symptoms, being told, you have IBS, when really it's actually endometriosis related gastrointestinal symptoms. And finally, another symptom that some people with endometriosis will have are heavy periods. Not everyone does, but that is one of kind of the hallmark or keynote symptoms. So something, some food for thought, things to consider to look at your period and to kind of look a bit further at the pain you're experiencing. How long do you experience it? Do you have pain outside of your actual period? Do you have pain with urination or bowel movements or sexual activity? And if yes to any of those questions, and it could be that your, menstrual cramps are not just menstrual cramps, but are actually a sign of endometriosis. So it's definitely something worth talking to your doctor about. In my next video, I'm going to talk more about how endometriosis, oh my gosh, I've said it so many times, can be diagnosed, and questions that you can be asking your doctor, how to advocate for the tests that you need, and maybe some of the strategies you can work with your naturopathic doctor in terms of testing and investigation and looking at things to give you a diagnosis. Ultimately, knowing your diagnosis, knowing what you have that explains your symptoms, it's not just for fun to be like, okay, cool, now I know I have endometriosis. It really can guide what you do in terms of treatment, how you choose to live your life, and certainly around fertility, which is a big piece of my practice. It can help you feel empowered about expected time it might take to get pregnant, or some of the ways that we know this condition can impact your ability to conceive. So I think it's important to get a diagnosis. And as I alluded to on social media this week, it can take up to 10 years on average for people to actually get diagnosed with endometriosis. This is a condition that's kind of near and dear to my heart. It's, because I have it. I actually have endometriosis, and I've been struggling with symptoms probably throughout most of my menstruating life, and really struggled as a teenager and in my 20s. And I didn't get diagnosed till I was in my early 30s. So it really goes to show that, this condition is tricky, and, because cramps are super common, we kind of normalize that experience for people. And then, one of my mentors and colleagues has talked about, as soon as we start to normalize symptoms, we stop looking for answers, right? We stop, if we even just like that to being tired, like lots of people are tired, and that's super common, but it's not normal. And once we normalize it, we stop looking for a reason. Maybe you have an iron deficiency or a thyroid issue, or it's stress, or it's nutrition, or it's a sleep problem. But we just make being tired so normal in our society that, a lot of people struggle unnecessarily. So I think the same is to be said for menstrual cramps. It is common, but it's not normal. And, I think you are deserving of a diagnosis. You're deserving to understand your condition. So more on that in my next video. As always, if you have any questions or concerns, or you want to chat through things on a more individual basis, I'm here for you. Feel free to leave a comment below, send me a DM, or certainly feel free to go to my website, www.shannonnd.ca, and click the Get Started button in the top right corner. And you can book a free complimentary 15-minute meet and greet. We can chat and kind of understand. You can give me a bit of background and history, and I can let you know if working with a naturopath is a good next step for you. Okay, take care. Thank you for watching.